Hello guys, welcome to our YouTube channel, and today we are going to discuss about different ways for the history taking of patients in the medical field. Hope you all like this video.
So today our topic is history taking. After the completion of basic phase, all we enter through the clinical phases, and in clinical phase, most important thing is history taking. So today we are going to discuss about the history taking. So let's start. First, the component of history taking. All we have to know the components. What are the components of the history taking? First is history. It includes the particulars, chief complaint, history of present illness, history of past illness, personal history, treatment history, social economical history, drugs and allergic history. This is history part. Now after history we will take examination, that is general examination, local examination and systemic examination. After examination we will go through the provisional diagnosis. After provisional diagnosis, we will go through the differential diagnosis. After that, investigation is done. After then, final diagnosis is done. Last one is management. So this is the only format of complete history taking and the examination. So today we are going to discuss about the only history portion, and we'll discuss this one by one. So before you taking history, all we have to know about the consent. So what is consent? Consent. Before taking history, we have to take consent of our patient or patient party. Without taking consent, we can't go through the history taking. So if you have to consent, is simply you can take permission from the patient party or patient, so we can continue our history phases. Now let's start with history. So here is a complete chart. Now first in history we will know about the particulars. That's personal particulars. It includes a name. So why we have to ask the name to the patient? Because it identify and clue about the country, state or region. Okay, we know that here we know the why we have to ask the name. So why we'll ask age? Because age gives the clue about the childhood disease like congenital disease. In adult, it gives the old age disease like a degenerative disease, neoplastic disorder. Now sex. Why you have to ask the sex? Because sex determines the disease. In male there is a common is lungs cancer, whereas in female there is a common is thyroid disorder. Now religion. Why we have to ask religion? Because religion gives us a clue about the disease. Like in Hindus we are less prone to colon cancer as we consume less meat, whereas the Muslim are less prone to carcinoma of penis due to the circumcision. Now occupation. Why we have to ask occupation? Because occupation determine and give clue about some disease like a scoliosis, like a varicose vein in boss conductors, in the mine worker. Now we have to ask marital status, and the main thing is date of admission and the date of examination. So we have completed the personal particulars. Now chief complaint. Or in chief complaint, always we have to ask and written in chronological order. Maximum 3, not more than that. If a Ram is, suppose is example, in Ram is suffering from shortness of breath, he has a fever and has a vomiting. So we have write the shortness of breath for some particular days, then after fever, then after vomiting in a chronological order. Now third one is HOPI. HOPI means history of present illness. It includes the onset, when it started, duration, how much duration it goes, progression, what is the progression of that disease, nature and severity, character, aggravating and the relieving factor, what are the aggravating and relieving factor that is disease, associated symptoms, and review of system, and we will ask for all systems review. Now last one is fourth one is our past history. It includes we have to ask the patient about the past history, like you have TB or not, you have a diabetes mellitus or not, you have hypertension or not, you have asthma or not. So we can correlate that, that is from past history. Now personal history. In personal history we will ask about his habit of smoking, alcohol, food habit, where he is a veg or non-veg, or the bladder and the bowel habit, he has a constipation, diarrhea or not, that things. Then after sleeping habitat, and appetite, whether his appetite is good or not. If our patient is female, then we will ask about the menstrual history, obstetric history, contraception history, because it also give order some disease. Okay, now the family history. In family history, we will ask about disease. If our patient suffer from the asthma, we will ask that patient if your family have a such. In family history, we will ask about the patient. If patient is suffering from the asthma, then we will ask about asthma, if in his family is suffering from asthma or not. Now, social economical status, we will ask about the occupation, what is her income, what is education, because it determine the living standard. Its occupation determine the clues of the disease. Education determine his personal hygiene and the standard. Now drugs and health history. In drugs and health history, we have to ask whether he is taking some drugs or not, from like our drugs of diabetes or hypertension or allergic history. We will ask about allergic history. If he or she is taking the drugs, if he or she has an allergy of that drug or not, because it gives because before starting treatment, we have to know the allergy, what patient is suffering from the allergy or not, which type of allergy he have, which drugs his response to that allergic. So we have to know about the allergic history also. So today we have completed the history taking portion. So we can see over here that is a complete history taking portion. The topic are the personal particulars, chief complaint, HOPI, past history, personal history, family history, social stat history, and the drugs history. Okay, thank you for watching us. Please subscribe our channel.